Good day, Franklin County. I'm a little excited. Do you hear it in my voice? I'm here to talk with one, speaking of passion, I'm here to talk to one of the most passionate public servants that I know. And that's Deputy County Administrator Joy Bivens. She is the leader of the county's health and human services agencies. She is our passion champion. She is our fighter for the smallest folks in the room at every time, always, every day. She is fighting for those that are marginalized and those that are underserved. And she want to make sure that we have no one in this county that goes unserved. And that leads me to our main topic for today, and that's the Franklin County One Door. It is a true no wrong door concept. It didn't open overnight. There was a lot of work, a lot of blood, sweat, and tears that went into it. But there were some philosophies that were unwavering, and that was that we were going to do it better than it has ever been done before as far as serving every resident every day. And we were going to do it in an innovative and a respective fashion for our residents with a lens of equity on everything that we do. So, DCA Bivens, after that introduction, I want us to first talk about health and human services, the structure, you as a leader, how you've brought together individual agencies that had been siloed in the past and didn't understand how they all fit together as a part of Team Franklin County. Me, myself, as a county administrator, I've joked that I think that you all have evolved to the point where I think you all speak a language that I don't even know what you're talking about, and I can be in the same room. So before we get into the One Door, talk about HHS and how that's evolved since our reorganization and its creation.
Absolutely. As you know, I started my journey with the county, because I was a case manager back years and years and years ago. And then I came back in 2015 and was the CEO. And then following that, I became the director of Job and Family Services. And so at that time, I oversaw one agency. And so then as my work continued, I was able to be blessed with the opportunity to be promoted, thank you, to become a deputy county administrator of health and human services in 2020. And so during the time when that opportunity was tasked with me, one of the things that was negotiated at the table was, hey, we need to figure out how do we break down the silos in our human service agencies. So my role, I oversee Job and Family Services, Office on Aging, Justice Policy and Programs, Child Support, Office on Aging, and the Animal Shelter. One Door now, as well as what's included in that is the mobile units. And so when you think about the history of when these agencies were created, for instance, Office on Aging is about 30 years old. Job and Family Services has gone through several reiterations of names. People used to know it as the Welfare Department and, all the things. And within these agencies, they operated from a transactional perspective within their own silo. What does that mean? That means if I needed something, particularly food stamps or food assistance, I go to Job and Family Services. If I need my grandmother to get a ramp, then I drive downtown and go into Office on Aging and I get my grandmother a ramp. There was no particularly organized structure and communication among the agencies, even though we're servicing the same population. Mm-hmm. And so the structure of the HHH agencies has changed where we have broken down the silos. We have more interconnectivity. We are now housed in the same areas, particularly on our mobile units and in our One Door, which is located at 373 downtown South High Street. And it's just a wonderful opportunity to see because, again, if I need Medicaid, 9 times out of 10, I may have a child support issue. And the data supports if you are interfacing with one agency, 32% of the time or 42% of the time, you're going to need more than another agency because you're needing other services as well. So it just made sense for us all to live in the same house, us all to break down the silos, because as you know, silos perpetuate racism and silos perpetuate isolation, and folks don't really get what they need.
Yes, and dignity is lost by having to walk through so many doors
Absolutely.
to get assistance as well.
Absolutely.
We need to normalize the process upon which residents receive human services. That has been an area where we need to improve, not only just in Franklin County, but the nation at large.
Absolutely.
Those that have access and resources, their interactions and their experiences to receive goods and services are much more efficient
Absolutely.
and provide much more dignity than those historically that have been have-nots.
Absolutely. If you don't mind, I'm going to share a story. When we went through the process of the Poverty Blueprint Plan, and this is where the idea really originated from. You know, the community said, why do I have to keep walking through multiple doors and reliving my trauma? And so one day I sat behind the desk at Job and Family Services, and I was sitting there with the administrative support staff, and a lady walked in, and she handed the clerk an obituary. The clerk was looking down, trying to, look at the name, but I was standing on the side of her, and I intercepted the obituary, and I looked at it, and I thought it was a young man, African-American young boy, probably about 14, 15 years old, maybe he was 16. And I remember seeing it, and I said, "Is this your son?" And she collapsed on the desk and just started wailing. And so I rushed around to, just to kind of hold her and comfort her. And she said, "Yes, I need to take him off of my case." And so I said, "Well, let me get you together." And she said, "Well, my mother is in the car with me, and she's about 80, and I got to get her some things too. And also, I just lost my job because as I was grieving my son, my company needed me back, and I was not able to go back." And in that moment, I thought, first of all, for all the things that she needed to go into multiple agencies, whether it's aging services, whether it's child support services, whether it's, again, food assistance, whether it's, whatever, why would we have that resident walk through multiple doors, relive that trauma of a loss of a child due to a crime? We have to do better.
Yeah.
We received a phone call in the summertime. There was a father living in a car with his children, and he was working at a fast food restaurant. And folks called us and said, "Hey, this is happening. You need to do something about it." And so when I got involved and intercepted it, and immediately, because we're mandated reporters, we have to contact Children's Services, and we did that. What was happening was the gentleman was working in a fast food restaurant, and he was bringing his children in while he was working his shifts, and then they would sleep in the car at night. We were able in that situation to temporarily put that single father in a temporary housing situation in a hotel, and then he was able to acquire an apartment once he was able to save his checks and those types of things. But those are the type of situations where you can't make a quick decision based on someone's circumstance, right? It is easy for us to say, separate, throw him in jail based on what we see, but that's not my lived experience to operate that way. I reached into my colleague over at Children's Services. We were able to make the right decision for this family. This man's children are doing so well in school right now. He is so happy. He sent us pictures of his apartment, and they are thriving.
That's great.
Yeah.
That's great. And it poverty has been proven to be toxic enough to an individual.
Oh yeah.
There's data that shows the third leading cause of death in the United States is poverty in all of the trauma that surrounds it.
Yeah.
It impacts your physical state, your mental well-being, and more people should realize that poverty is more than an economic state. It becomes a mental state.
It is.
And poverty is different than a temporary financial hardship,
It is.
because those that have resources and support around them can overcome a temporary economic hardship. But poverty is debilitating,
Very much so.
almost to one's muscles, to one's mind, and it is a financial and a physical state that you're in.
Absolutely. Absolutely. And it impacts everything, like you said, your mental health, your physical health, the way you're able to function from day to day, right? Being able to access things is just, it becomes overwhelming. And so what we see is, there was there's been situations where people have, committed, crimes of poverty, desperation, putting gas in the car and driving off because if I don't have enough money, and I know I have to get to work and I have no money, and I only have, there was a situation we heard about, person had 30 cents in the bank, but they had to get to work or they were going to lose their job. And stealing is wrong, but at the same time, for that to be your last resort to think about how to get to work, that lets you know how poverty has consumed a person's logic.
And I think one of the things you bring to this leadership position is a strong sense of awareness mixed in with empathy for those that are in this situation.
Yeah.
One of the things that I watched you do early in your tenure when you were the Director of Job and Family Services was you would put an empty chair in the room, and the whole time you're preaching empathy, you're preaching let's not be transactional, you're preaching that we need to do this with a sense of passion. You had your staff looking at that chair and said, this person is here. They might not be, you don't see them physically, but they here. And I need that to be in your mind each and every time you have interactions with people.
Right. Well, we are making decisions for folks who are not in the boardroom or in the conference room or in the meeting with us regarding policies and procedures that impact the community's life. The empty chair always has to be at the center because we will make decisions based on convenience, right? We'll make decisions on, okay, I can shortcut this process because I can be more efficient with my work or I can get done faster. Not thinking that one decision could be the decision on how somebody has access to food, housing, or clothing, right? And so you always have to remember the why you are here, and the why we are here, unfortunately, is because of poverty, but also it's not just numbers when we see percentages of homelessness or, food insecurity. There are families attached to those numbers. There are children attached to those numbers.
Right.
So keeping that chair empty and always keeping that at the forefront, it allows us to make better decisions and having them included in the decisions that we're making so they can help us solve some of the issues that they're facing.
I know you understand the importance of data and facts in creating better public policy when it comes to lifting individuals out of poverty. But I venture to guess you won't be bringing very many recommendations to me anytime soon for AI or artificial intelligence to make people decisions when it comes to those that walk through the door that's one stop, will you? And tell me why. Absolutely
not. I have to go off of the real human situations that I've been challenged with. I've spoken to grandmothers whose their sons have been killed and they've been left caring for children. And they don't need, maybe they do for efficiencies, but for me, it has been the holding of the hand, the wiping of the tear, them looking someone in the eyes and me demonstrating that I genuinely do care. Our staff really cares. that really impacts a person's mental health, and encouraging them that it's going to be okay. It's going to get better. We're going to get you what you need. I need you to stay encouraged. That goes a part in that plays a part in the service delivery. And AI can't do that. It can be efficient.
Yeah, probably another episode where I'm gonna have a guest to challenge us. We're gonna have AI advocates sitting between us, and I think they may challenge us that AI can revolutionize everything we do.
Oh yeah, I sat on a national panel with a person
have a
challenging.
sense of care. We're gonna do
Yeah.
we're gonna do a talk of the county. We're gonna have a AI advocate. When we talk about decisions about an injured worker and whether they are provided workers' compensation benefits, or an individual that has been in, a car accident, and to determine the extent of compensation that may be due to them, putting that into the hands of AI. I think we need to be careful for AI to make determinations for one to have food benefits or housing vouchers
Absolutely.
I
don't think we're ever going to get away from the need of human interaction. And although we can, self-engineer computers to, be empathetic, it's just not the same. And although, AI can play a tremendous role in, lifting some of the business processes and burdens of work and the capacity of work that we see every day, but a computer can't hug someone. A computer cannot encourage someone to make them feel genuinely that a human cares about them.
What makes the one door different than the so-called one-stops of the past?
What makes it different is, particularly for Franklin County, first, we've never done it before. And we're piloting it in the government complex downtown. And so every month, there was about 163,000 residents that come downtown, whether they're coming to get a marriage license or coming to pay a parking ticket or going to see a judge or whatever the reason. It is the first time in the history under the Board of Commissioners that all of our human service agencies are sitting, working side by side with each other, in addition to some of our community partners. And so we are looking at data on what is the best partners to be in the one door. But then also you can walk in needing one thing, but we ask the right questions to make sure that you get all the things, even the things that you are not thinking about.
How do you think experiencing the pandemic has better informed us in the health and human services space, and how it will inform us to be able to do a better job as far as implementation of the one-door concept?
I think it awakened us to some of the previous conversation that we were having. We have hundreds and thousands of folks walking through one door for one thing. So if you look at Job and Family Services, there's about over 400,000 residents that receive Medicaid. So whether I receive it over the computer or if I walk in the door, I'm going into that door only thinking about my Medicaid because I know that's where I can get it. I never think of it from the perspective of, how can I also get some of my other needs met? And what I think the pandemic did was it opened our eyes to being more efficient and being able to streamline and to align our services so that residents can get all the things all in one place and not creating the burden of, again, having people relive their trauma, retell their trauma. And I think it allowed us and awakened us to be a little bit more sensitive to the needs of our residents and not just doing business as status quo. Because I think for many years we've done it just because that's the way we've always done it. Just like people worked from home. People worked from home and we were like, we can still get work done at home. But because we can get work done at home, but we've only worked in buildings because that's the way we've always done it. And there was a better way to do it.
Housing and homelessness has been managed fairly effectively in
Yeah.
Franklin County. But we know that there are weaknesses that have been identified in our system
Absolutely.
that we got to correct. How will the one door help us better connect the dots?
So in working with our community partners, we're going to be placed in the one door, we are able to identify early if you're going to present yourself to be homeless based on the assessment that we created. You know, a lot of the homelessness or eviction issues that we're seeing, particularly from the agencies that I oversee, many times people have more month than they have money and are not able to pay their rent. And if we know that and you're coming through the one door, we may ask you the question, well, it looks like you're only making this amount of money. Would you like a better paying job? Let's put you in a training to position you so that you are not always having to make decisions for rent versus a lights. It allows us to be more proactive in that way.
Let's go back to the Rise Together Poverty Blueprint, and let's walk through the planks that it was built on. When we talk about health, we talk about youth, we talk about housing, we talk about education. The Franklin County One Door, how will it be built to respond to an individual that may be challenged, have multiple symptoms, so to speak, because we want there to truly be no wrong door, and we don't want to be siloed.
Absolutely.
Real time, rewind less than 24 hours ago, we were talking about when you walk into the one door, we don't want you to have to be labeled by having multiple doors once you walk through the front door.
Yeah.
Kind of talk about, in a perfect world, how you envision that working.
And so in a perfect world, when you walk through the one door, of course, you'll have all of your human service agents under the Board of Commissioners, in addition to some of our community partners like Columbus Impact that works with not only utilities, but they have housing dollars, supportive dollars as well. In addition to the Columbus Urban League will be involved working with our youth population in assisting them in some of the things that they may need. But in a perfect world, when you do that assessment, it identifies what needs you may have. And then before you leave, we are going to connect you right there, provide you with the resource right there, and not give you a 1-800 number or a 233 number and send you somewhere else. We're going to, as much as possible, try to provide all those supportive services in place. When you think about the aging, particularly for our kinship, as you know, we have a lot of grandparents taking care of young folks.
Yes, we do.
Right? Y'all grandparents that they did not plan on taking care of these younger folks, right? And there are things that they need that they don't even know who to call first. Imagine being a grandparent coming downtown and, obtaining custody of your grandchild, and then you're thinking, what's next? I don't have a bed. I don't even make enough to feed this grandchild. And then there may be a custody issue where I can get some children's service dollars as well. And someone directing you to the one door as a grandparent saying, before you leave, stop at the one door. You do the assessment, let us know what you need, and we make sure before you leave, we provide you with all the supportive services that you are eligible for. And as a grandparent, you feel less overwhelmed.
Next, let's talk about how another important component of our Health and Human Services strategy, the Family Stabilization Unit. Let's talk about how the Family Stabilization Unit will work in concert with One Door and how they will complement each other.
So as you know, the Family Stabilization Unit was created back in 2020. And it was for us to test policy from the the results of the Poverty Blueprint Plan. And in the Poverty Blueprint Plan, it was identified by the people, because we call the Franklin County Poverty Blueprint Plan the People's Plan. The people told us that racism was an issue as it relates to poverty. And so we were looking at a system that we can test, a collective impact model system where we can make some, move the needle a little bit. And when we looked at the juvenile court, that was a system where a lot of African American young men were interfacing at high rates. So they were gracious enough to partner with us. And what we do with the Family Stabilization Unit, when a young person comes downtown before a judge or a magistrate, whether they threw a rock in a window, whether they stole a car, whether they, cussed out grandma or didn't go to school and they were truant, they go before the judge or the magistrate, and then the Family Stabilization Unit staff wraps around the entire family, not just the young person. Well, what does that mean? That means if there was a grandmother in the house, an uncle in the basement, we call everyone together and we ask them, what are your collective goals? How do we assist you either moving up the economic mobility ladder or changing the environment in providing supportive services so we can create a more nurturing environment for this young person? And we walk life with you for an entire year. And so it's not just a transaction unit, it's a transformative unit. So when you come downstairs to the one door, if you were referred by the court, the juvenile court will provide you with all the supportive services through the agencies, but you will be assigned to a Family Stabilization Unit specialist to do all the things I just talked about. They're going to assess the entire family. If you say you can't pay your rent, if your lights are about to get turned off, if you don't even have beds, how do we assist you in addressing some of your barriers so that you can start thriving and creating a better environment for that young person? Because, the environment plays a tremendous role in the success of a young person, right? And if I'm couch surfing, or if I don't have a place to live, or, all those things, and I don't have food in my refrigerator, I'm acting out in school. Sometimes I don't want to go to school. So you see a lot of young folks truant, right? Or I'm just acting out. And how do we provide those mental health supportive services for the family and the young persons? And you will see that in the one door as well, because we'll be partnering with Adam H. and some of our mental health supportive partners.
That's why personnel and human capital is so important in our work. And that's why, as county administrator, I'm always in recruitment mode. I try to be out in the community as much as I can, encouraging people to say that Franklin County is a great place to work. Franklin County is a place where you can have a positive impact on the lives of the residents. And you may have never envisioned yourself as a public servant, but you can be a public servant.
Absolutely.
And regardless of what your skill set is, I think that it's a good possibility we will find a place for you.
Absolutely.
And if we're really successful, we'll help you find your superpower. And when we help you find your superpower, then you really will be able to go to comic book levels of success as a Franklin County employee. And when you talk about the young people, mostly we have a lot of young people that work in our FSU unit. We welcome people of all ages. But we've been recruiting young adults that really want to make a difference. And it takes bravery. I think a lot of times public servants, the level of dedication, sometimes risk that they put in. When you go into a house where there's so many negative stereotypes attached with, particularly in the child welfare space. And our FSU employees approach the family much like social workers of a prior time, because they're trying to help the whole family. What triggered me when you said even the uncle in the basement. The basement may be dark, and our employees are going to go down there and try to see what the issues are that has kept Uncle in the basement
Right.
and try to talk through it. And that could be dangerous
It sure can.
because there's people in the family that don't never go mess with the uncle in the basement in some households. They like, uncle comes up when he want to, and nobody leaves him alone. And then here go Franklin County with an FSU unit, and we gonna go in here and we want to talk to everybody. It takes courage for that.
Absolutely.
And it takes leaders like yourself that want to help the whole family.
Absolutely.
Because it's the easiest thing to do is to walk away from what's hard. The easiest thing to do is walk away from the student that don't want to listen, that may be acting out, that teachers could just tune them out. It's the easiest thing to do and pass them along versus putting in that work it takes to put that child in an atmosphere. 20 years ago, I don't know if we talked about sensory rooms. We just suspended the kid from school and they were gone. And we didn't know what happened to them. Then they come back. Then they get in another fight because the same problems. Or they acting out, they back to the principal. And it was cyclical.
Yeah.
But now we got some brave people that want to make a difference. And I think we have a number of them here in Franklin County. I've been fortunate enough to highlight some of the work that's being done on top with this Talk of the County podcast. Because if you want to do the hard work, you can change a person's life, but it takes the hard work a lot of time. And you don't have to do this DCA business because you have your own life experiences that could cause you to say, I already know enough about that life to be able to be an expert that I could tell everybody what's best.
Right.
But I know you went on a CODA bus riding tour and you walked from the bus stop to the bus to sort of bring it back fresh.
Yeah.
Because now you blessed to be the first lady of the city of Whitehall.
Oh my gosh.
So you know your life is different when you walk in rooms.
Yeah, but you don't lose. So if you've ever been in poverty, it's always a thought away. And that is one of the debilitating things you talked about earlier. Like you always have to think like you are always a thought away. And it's not us and them, it's all of us, right? And it's a very complex situation. When you talk about FSU, we have some seasoned people in FSU as well. But we've had, our specialists go to homes. They went in a home to see the family. They walked out. 15 minutes later, the house was shut up. Or they got to the house or the young person had been killed already because, these are young folks that are all walks of life. Again, truant to car stealing, to gangs, to all the things. But you have folks that are committed to saving our community, right? And, I have gotten on the bus because I want to see what it's like. We're making decisions on people keeping the empty chair open. So, I have a car. But let me see what it's like to jump on the bus with a stroller and simulate 5 grocery bags, right? Understanding there is a mile for me to get to the next thing that I have to get to because the bus only drops me off at certain places. And then when I walk into this human service agency, how am I being treated? I just got on the bus. I have a stroller. I got 5 grocery bags because I can't, there's nowhere for me to put them. And then if I walk into an agency, I want to make sure that I'm being treated with dignity. I've gone into the homeless camps in the dead of winter to meet with those folks, just to kind of see what are we not doing? How are we not reaching you? And if I have to be authentic to me, but I also have to be authentic to the core values in which you all and the commissioners have laid out, and making sure that when we talk about human-centric, it is making sure that the community is involved in us developing, solutions to some of our complex issues. So I try to ingrain myself in the community, in the process, not letting it allow me to get so far ahead of me that I make a decision because I never want to make a decision I'm going to harm somebody.
Right.
And harming somebody could be you hire the wrong person and they talk crazy to someone, or harming a person, you changed a policy that you didn't consider that impacts 5,000 people adversely.
Right. But if they talk crazy to someone and word get to you.
Don't talk crazy.
Even though you're a deputy county administrator, some people get the rude awakening of, she would come talk to little me. And then they be like, she on her way. Yeah, we told her. You told who? and then they find out who got it. So, but that leads me to you are passionate, as I said at the opening of this podcast, but you also are a disciplinarian, and you demand accountability. You have that side to you as well. So it kinds of, you like that parent that, would hug up their kid, but if they got in trouble at school and find out she coming, they know it is not going to be a pretty sight. The principal going to be the least of their worries till you get there.
Exactly. There's a thing called you going to get some act right when I see you. Yes.
So, but with that being said, though, to your credit, here as a Franklin County public administrator, I would say you are one of our second chance champions.
Oh, absolutely.
Because although you demand accountability, you're a disciplinarian with some of that sprinkled in, you have also come to leadership and said, give he or she a chance. Absolutely. I believe that they've learned from their past in that they are going to be successful.
Absolutely.
And I've seen it happen.
Yeah. Everyone, we make mistakes, right? And if you're going to hold me accountable to a mistake I made 10 years ago, 15 years ago, 20 years ago, then you've put me into eternal purgatory. That ain't right, right? If particularly I'm thinking about second chance citizens, and many folks, I made a mistake. I want to move on with my life. How do I, I'm trying to get a new opportunity. If we say no based on what is on the paper, or say no based on a mistake that you made, we're not helping you, right? We're hurting you. And then we're throwing you back into the mistakes, the universe of mistakes that you can, continue to make. So we always have to be very compassionate and empathetic, and looking at the situations of not one person is their worst mistake they've ever made, because we all make them.
If you were selling the one door to a board of investors, what would you tell them to get them to be more likely to invest in the one door?
So if I were looking at a board of directors, of private investors, what I would say to them is I would make a business case. Their corporations and businesses are made up of people who have very complex lives. They have caregivers, they have mothers, they have fathers, single fathers, they have parents with children with behavioral health issues and mental health issues. You want to invest in this one door model, because what it does is it allows that resident that is working in your corporation to come in and get all the things that they need, and it gives them back the gift of time. It allows them to have those supportive services, and so that when they walk into your building to do the job that you have hired them to do, they are more focused, their mental health is better, and they are more alert in showing up for you every day.
Okay.
And so it will increase productivity.
Okay. So as we wrap up here, I usually go offline and ask a couple questions to give our podcast listeners insight to the person. And it's easy questions. Easy questions. Nothing to put you out there.
Okay.
Beach or mountains?
Oh, definitely beach.
Wine or bourbon? Wine.
It depends on what day, the season. Wine in the summer, bourbon in the winter. Yes.
In moderation, of course, but it depends on the season.
Or if I'm sick of hot toddy.
It depends on the season.
Yes.
Okay. Tacos or chicken wings?
You can't pick between tacos and chicken wings. I like a good fried I like a good fried wing though. Yes, wings.
Okay. And my final wrap up. This is a softball, a layup, or whatever analogy you want to use. If there was one word that would summarize the personality of DCA, Joy Bivens, what would that one word be?
Oh my goodness. I would say compassionate.
Yep, she scored the bucket. She scored the
I
bucket,
thought you were
folks.
gonna ask me about rap songs, like a
I
rapper.
wasn't gonna say your favorite book. Yeah. Oh, what's up? I did. I usually would ask. So, what's your top 5 songs on your digital music device of choice? But I didn't do that. That's for another episode. You're such a dynamic individual that we will have another Talk of the County, folks, with DCA Joy Bivens, and then we're gonna go into a lot of other spicy subjects. We're gonna talk about her favorite sorority on earth and such things.
There's only one, isn't there?
And what sorority would that be?
Delta Sigma Theta Sorority Incorporated.
Okay, you all heard it first. You all heard it first.
J15 is coming.
With a I was about to say, and with a Founders Day coming.
I'm sorry, J13. J13 is coming. J13 is coming. J13 is coming.
It's coming. It's coming. So I want to thank you all for listening. And as we always conclude, do you, because nobody else has time to.